Hello and welcome, everybody. This is Holly with the Holistic Nurse Academy, and we have an awesome guest today, Bonniejane Monson. I'm excited to have her and have this really good discussion about pelvic floor dysfunction and the connection that she's found between the physical aspect of it and the emotional aspect of it. And so we'll dive into that. Hi, Bonnie Jane.
Hi.
I keep on to call you Bonnie.
Yeah,
Bonnie.
you're good. Some people call me Bonnie. That's fine. Yeah.
Okay.
Thanks for having me.
So we are always bridging the gap between Eastern and Western medicine. So we're going to dive into your journey to
Mhm.
that. And but first, I wanted to start with who you are and your background, so people get to know you a little bit better. Dr. Bonniejane Monson is a pelvic health physical therapist and somatic practitioner whose work lives at the intersection of clinical precision and embodied wisdom. I feel like I want to put a little note in there, like a little tap, because I want to come back to that. With deep roots in mind body medicine, trauma informed care, and nervous system regulation. She has spent years guiding individuals through healing from pelvic pain, sexual trauma, birth trauma, and the body disconnection that so often accompanies religious or purity culture upbringings. That one to one work became the foundation for something larger. Alongside her individual PT practice, Dr. Monson is now creating Wholesome Already. I love that title. I love that
Hi.
so much. A somatic wellness company offering group programs and women's circles centered on reclaiming the body as a source of inner power, pleasure, and creative life force. Her work draws women back into relationships with the erotic, not as something outside themselves, but as the deep. Generative intelligence that was always already there, not as something outside themselves, but as the deep. Generative intelligence that was always already there. I'm going to say this again because I'm going to edit this because I want to get this line
You're
right.
totally fine.
Not as something outside themselves, but as the deep generative intelligence
Mhm.
that was always already there.
Mhm.
She brings neuroscience, somatic practice, and embodied spirituality to create spaces where women remember what their bodies have always known. Her pleasure practice includes being in the mountains, biking, skiing, and playing with her kids. Yes, I like all those things too. So, welcome. Hello.
Hi, thanks. Thanks for
What a
having me.
cool introduction and bio. Um, like I said, I wanted to come back to clinical precision and embodied wisdom.
Yeah.
Tell me more. Tell us more.
Yeah, so as far as the clinical precision goes, I am very much about getting to the root of whatever is happening that somebody brings to me and what's happening in the body. And there's always the aspect of there's aspects of nutrition that is not my realm, and so I refer out to that stuff. But the stuff that I do navigate is what is the body trying to tell you? What are the messages that are trying to come through? And that is the precision. And where is it held in the body? And what is the nervous system doing that it's like, why is it safe enough to stay in the pattern that it's at?
Mhm.
And so the precision is really listening deeply to what the body, what the message is, and then the helping the person be able to embody whatever that message is, whether that's taking a step or letting go something go, or stepping into a part of themselves that they haven't allowed themselves to yet, giving themselves the permission, whatever that thing is, or just working through whatever it is that just unlocks that part of the nervous system in the body.
Yeah. So when I, was reading your information and kind of diving deeper into who you are and what you do, I thought, okay, we have lots to talk about because I do somato emotional release
Hmm.
through cranial sacral therapy.
Yeah.
And so what I want to come back to this,
Hmm.
but we won't do it right now, but I want to talk about how you do your specific somatic work, like
Yeah.
what the process is. But before we dive into that, I want to just kind of know your journey
Mhm.
on, because I think what, from what I understand, you were, and you continue to have your own PT practice, right? You're
Mhm.
a therapist.
Yep.
And you started this Wholesome Already practice with somatic work because you said that you noticed something was missing and that inspired you to kind of dig deeper.
Yeah.
Will you tell us a
So
little bit about that
yeah,
journey?
so let me go backwards into kind of like the bigger journey of
Yeah,
where
yeah.
I came from, right? So I went to PT school, thought I was going to do at the time, I thought I was going to do athletic training and like sports medicine and orthopedics, and that was the realm. And then I got into PT school, um was open to the idea of doing, at that time it was called women's health, now we call it pelvic health. Um, and so I ended up doing an internship at Duke, and that was like at the time it was the only place that had a residency program for pelvic PT. Or no, there were two programs, I think. But anyways, I ended up doing internship there, and that was just like a yes, this is my space. So that shifted me into kind of deepening that understanding. And then I ended up working under a woman in California for a while, and then came to back to Utah. And then from there, I started opening a deeper aspect of pelvic health within the University Orthopedic Clinic. So I was up with the doctors for a while and kind of grew the program. And then after a while, it was clear that I needed to be out of that system because it was just more holistic. So I had a really deep background of medical and understanding, the Western medicine side. I was deep in it for a long time. And then I just started going on my own journey on the side note of I had my own birth trauma that I was working through, and that started opening me up to other things, and then things that were happening in my family and my own kind of awakening in many ways started opening me up to alternatives. And at the same time, I was sitting there working with so many women, especially in pelvic pain, and I really liked working with people that were having sexual dysfunction or pain with sex. And I got sick of managing pain. Right? It was this constant like, okay, well, try these stretches, try these exercises, try these breath things. Let's go in and stretch the pelvic floor and while all of that can be good and helpful, right? It felt like putting a band-aid on.
Right.
And I kind of got sick of putting band-aids on.
Well, how did you
Um,
figure that out? How did you figure out that it was a Band-Aid?
um, Partly because nothing, it wasn't like it was still in this place of management. It wasn't in this place of shifting. There was no shift of mindset. There was no shift of like people being able to do what they really wanted to. Maybe it was for a while, but so it was that aspect of feeling like I just kept hitting a dead end and like not being able to hit goals
Yeah.
with people. And then in my own life, because of my birth trauma, I started having my own issues, and um, and that started going down where I started having to go, not to make like the whole story, but I ended up having and I was trying to go natural, had an epidural. The anesthesia just went too far, hit a nerve. I had a CSF leak or spinal fluid leak, right? I ended up having um, some spinal injury off of that, was basically stuck in a chair for 6 weeks postpartum, had to have 24-hour care, couldn't move, was in back spasms, ended up having long-term pain.
Mm.
It was just like, meanwhile, I was navigating relational issues, and that was my first kid. So it was just a lot going on.
Yeah.
And so that kind of dove me into my own healing and realizing that my own issue, like all of that, well, yes, there was an injury, there was an actual injury, there
Hmm.
was so much deeper aspects of that that I had to start diving into. And the more deeper I went into my own healing and went into different modalities and started using those with other people, then things started shifting. And then
Mm.
I started to see people actually make changes, and it was no longer managing pain. It was like chronic pain that had been there forever was now like significantly diminished to where they were able to be functional or was completely gone.
Wow.
And so I just kept diving deeper and deeper and realizing there is something here that is being missed in training, is being missed other places. And now fast forward, I've been doing this work in somatic work for about 13 years. And now the shift that I'm seeing and why I created this new program and I'm going to be launching this is because I see, especially here in Utah, that women are disconnected from their pleasure. And it's almost like there is no permission to rest or to have pleasure. And I really want to focus on that and help people shift into living a life full of pleasure.
Love that. So important. And I don't ever want you to apologize or hold back on telling your story because that's what makes you unique, right? Like
Yeah.
that's where um, the meat and potatoes is because what the evolving theme as I'm having these conversations is um, we're all having these personal journeys that
Mm-hmm.
go, oh, like Western medicine could only get me so far, and I had to delve into some other outside the box practices, which
Mm-hmm.
fit typically in the Eastern medicine, but not always
Yeah.
box. But so I love the story. I love how, it was created. Another way of saying it, how the sausage was made.
Mm-hmm. Yeah.
Not the classiest, beautiful term, but like
Yeah.
that's what a lot of people want to know is how did you get here? So
Yeah.
um okay, I have this theory that most of us start doing this like transition about 15 years into our practice. How many years into your practice were you?
Not that far, actually. Let me go back time wise. So I graduated PT school. It actually was early.
Okay.
I graduated PT school in 2010, and then I left the U in 2018, 2019. It was right before COVID hit. It's like the, year before that.
Mhm.
So I started diving deep into what started my awakening. My son was born in 2013. And that's the year that I started diving deeper into my own healing.
Okay.
So by the time I left the University of Utah, I had had a couple of tools already, the somatic tools, and then I've just
Mhm.
kept diving deeper and deeper and deeper into that.
Yeah.
So, at this point, I'm 16 years in practice.
Okay.
But now I would say that's interesting you say 15 or 16 because now I feel like the thing that I'm really meant to do is now fully evolving.
Right.
Yeah.
Right. Yeah. So I agree. There's right when I graduated nursing school, I was going through my own life crisis, and that's when I started exploring for myself
Hmm.
some of these outside the box modalities. But I had no idea where,
Hmm.
that it would lead me to where I'm at today, having these
Yeah.
kinds of conversations. But so, yeah, I was implementing those tools in my own life. But it took me about 10, 15 years to like really feel like I could go out there and share the information
Hmm.
and saying there's something really to this. And
Yeah.
we need to be branching out for clients and patients and ourselves
Hmm.
and giving people options outside that, like you were saying, we were just treating the pain, but there was something deeper going on.
Hmm.
And so I'm interested to know more about what those exact tools are that you use.
Yeah.
So like where was it one specific route or path, or are you pulling from different places and bringing it all
Mhm.
together?
Yeah, so I am somebody who pulls from, I'm kind of a Con Ed junkie in a way. And
Hmm.
so I just am constantly going to classes it used to be in my development, it used to be because I felt like I didn't have enough and I always had to have more and more and more. And I'm not at that place anymore. I'm now at the place of like, if I want to learn it, it's mostly because I'm just curious
Yeah.
because I feel pretty solid within how I work.
Yeah.
But it's definitely been an evolution. So I started through, and I can see how each modality led to the next modality.
Yeah.
So I started out with, there was one called neurokinetic therapy, NKT, that was really an outside of the box, like from typical orthopedic world. That was a very outside of the box. And then but I realized that was like, it had some things to it, but it really wasn't until actually my husband at the time had epilepsy. He was military and had ended up having seizures from in his military service. So it was adult onset. And we were trying to figure out how to navigate all of that. And he was having 3 different types of seizures, and he was having seizures anywhere from every other day up to about 3 times a day. So I couldn't leave my kid with him. And it was like trying to figure out answers. And one of my friends was like, hey, you should go try this modality out. It's called proprioceptive deep tendon reflex, or PDTR. It's a horrible name, honestly, but but it's basically, for those that kind of know, it's based off of kinesiology or applied kinesiology, but it is, I would say, it's much wider spectrum than that. And at the time, like, I had no idea what they were doing, but at the time we went to go see the guy that created it, who's a neurosurgeon out of Mexico, but the treatment was like half an hour. I had no idea what was happening. That was in February. He was supposed to actually have a vagal nerve stimulator put in March. And I was just like, we're going to try everything before going down that road. Right. So he had this one treatment by this guy in February, and then he did not have another seizure until August. Oh. And I was like, what the heck just happened?
Yeah.
So that's why I learned that modality. And he ended up not having that vagal nerve stimulator put in. And he's had from that treatment, there was about a 75% reduction in symptoms from that. And now I know what they did. He did a reset of the cranial nerves. Okay. And there's a lot deeper other stuff that was sure. Connected to that. But so I learned that modality, but that modality opened me up into, they do a lot of emotional release work. Yeah. And it kind of looks like EMDR. Okay. Because you use eye motion, but you connect it to organs, knowing that there's a direct correlation to where we hold emotion in the body. Mm-hmm. And that comes more from the Eastern side. And so that led me to understanding more of the neurological connection to emotion, and then how that connects to organs. Meanwhile, I started doing hypnotherapy training. But the hypnotherapy training that I did is different than like typical hypnosis. It's called cellular release therapy. It's specific for trauma clearing. And it's more like a dialogue than directives. Yeah. And so that led me down a whole nother rabbit hole of realizing how incredibly powerful the subconscious is, and how quickly it can also change when given the right conditions and feeling safe. And so I started using those modalities at the University of Utah. And, there was kind of kickback by some clinicians, and others just kept sending me there, people that weren't getting better. And yeah, it was really interesting. It was super interesting. And then I kicked out of the system, and I started doing, just hands-on work. I started doing in the Baral work. So Baral does neural manipulation, visceral manipulation. They're kind of adjacent to what you did with the upledger with craniosacral. So I've taken the craniosacral, but for me, the path was more like I really needed the actual anatomy. And that was probably because of just the PT background, or maybe it's just that I needed for my hands. But in that training, I really got an appreciation for the layers of the body, and being able to listen deeper into, where is the body taking me? What structure am I on? Where is this at? What's happening around here? How is it connected to everything else? And listening to both like the global big and also the local structure, and what's happening there, where the restriction is, what's happening. But I noticed as I was doing that, because they always talk about in Baral, they talk about like the actual restrictions and listening to the nerves and listening to the tissue itself. And at the same time, I just started feeling all of these emotions come through my body, and I started getting pictures and stories of things happening. And I would be like, what is this? And I would start asking the person about, hey, are you noticing, like, what does this mean for you? And there were just these crazy connections. I remember the first one that I actually worked with this was actually at the U, and this was why it was like, this guy had been having chronic migraines and chronic pain for, I want to say it was like 10 or 15 years, maybe longer. And I fell into his body, and I had this picture of this like girl that was maybe 8 or 10 years old, and I kept hearing this voice, and I was like, I don't know what this means. And the name came through, and I was like, I have no idea what this means. Like, does this mean anything to you? And it ended up being this girl that he had been with, that what he grew up with, that had been made fun of, and she ended up committing suicide, but he had been the one friend to her that would walk to school with her every single day. And he had been carrying this guilt around us for so long. Right. And at the time I was like, I don't know that I'm the one that can help you with this, because I didn't know, it was so new that I was like, I don't know what's going on here.
Right.
But that opened me up to, oh my gosh, there's way more here. There's way more that we're missing. And then little by little, it's been funny because I've just had these things start to unlock. It's almost like skills have been unlocked for
Yeah.
me, whether it's, just depending on kind of how that unlocks or timing, that I just keep having these things almost be revealed. But my new favorite one that started about 2 years ago, maybe it was 2 years ago, is I get songs. I get songs, like people give me, like their bodies give me a song. And there's something about that song in the words of the song that has a message for them, that is something about something they're going through. And again, it's not mine to determine,
Right.
but it's mine to help them understand the message. But it's been really fun to just see kind of what songs come through for people.
Yeah. That's so
Yeah.
wild. I
Yeah.
love that. So what does the somato process look like? So I guess maybe tell us like what a functional
Mm.
process looks like, and then what the somato process looks like, how they come together. Walk us
Yeah.
through
So, and then I tell you, so I also
that.
trained in NARM, a neuroaffective relational model, and that is more on a therapy side of things. And then I have some training in body work of, um, oh my gosh, I'm losing it. SE, everybody, it'll
What's
come
it?
to me. SE.
Okay.
Uh, oh my gosh, I can't believe I'm losing my mind with that. It'll
I
come to
do
you
this
at some
all the
point.
time,
It's
don't
fine.
worry.
It's fine. But anyways, those are more well-known actual somatic modalities, especially in
Right.
the therapy world. So I got trained in those. So I
Right.
really feel like I have a solid base within like the therapy world as much as I could without becoming a therapist.
Yeah.
But then also holding into this physical side. So when somebody comes and sees me, um, part of that, it can look like I am talking to them, and it can look like talk therapy, but it's not talk therapy at all, because I'm constantly reflecting them back into their body and noticing what's happening, slowing the process down, and just observing and creating a mirror for the observation and getting them curious about what's happening with this. What is this? Are you noticing that you're doing this? What is your breath happening? What are the sensations that are showing up? Because so many people focus on the story. And while the story can be helpful, it also gets us sidetracked to what
Yeah.
is actually there.
Yeah.
And so I'm able to help people slow down and recognize what is happening in the nervous system, that the interpretation of those sensations keep running in the same thing over and over again. And often it just needs a new interpretation. So helping the person kind of figure out, how do you want to interpret this? Right? How do you want to see this instead? So
Yeah.
that is more like somebody on the couch, and we're talking through things where I'll take them through a guided kind of like practice meditation, somatic feeling into the body for
Okay.
them to kind of change things.
Is it like
Sometimes,
rewiring the brain?
yeah, it's some of it. Yeah, a lot of it is rewiring the brain
Okay.
and kind of moving through the energetic perspective too.
Yeah. Okay.
I do a lot of boundary work on energy as well, because that boundary work is so important for safety.
So what is that? Give me a little
Um,
bit more on
Yeah,
that.
so it's teaching people how to feel an energetic boundary, what
Oh,
that looks like, what that experience is, because it's really experiential. That's the hardest thing, is that all of the work that I do is so experiential
yeah.
that it's hard to put words to.
Yeah.
Um, and so those are boundary practices. Those could be boundary practices where they're feeling into their sense of self and noticing where maybe they've had something like a rip or a tear or a hole in their boundaries that just needs repair work. And what does it feel like to repair without the story? What does it feel like to actually hold space for yourself and give yourself permission? What does it feel like to have your boundaries actually supported and acknowledged? And that's really important when I go to do pelvic work, because so many of the people that I work with have a history of some type of difficult sexual experience,
Yeah.
or even difficult, violation experience, whether that's medical or not.
Right.
Um, and so it's helping someone recognize that they have sovereignty within their own body, and that they can speak that they can hold that space. So that when we move into body work, so the functional side of things is then we go into like muscle testing, when we go into pattern testing, to see, and then I go into more of the like manual hands-on work of listening to the body and seeing what's showing up in the patterns and where the specific spaces in the body that need help are. And so then that goes on to table work, right? And maybe that is we're doing specific pattern movements. Maybe that's I'm just doing some release work and working with them, we're having a discussion on the table because I'm bringing things up that I'm noticing. They're starting to talk to me about what they're noticing and experiencing, and it's very much a co-creation. I am not there to be an authority for them. I'm just there as a guide.
Yeah.
And
You
so,
say on your website, a facilitator.
yeah.
That's what I feel like I am too.
Mhm.
Practice, I'm a facilitator. We're just holding space for people to, because it's already there, right? Like, is that what
Mhm.
you've been,
Yeah.
that's what you found out? It's
Yeah, totally. It's there.
there. We just sometimes need kind of like the coach on the sideline to help us
Hmm.
navigate it and help us build trust with
Yeah.
ourselves, that we can trust that initial instinct
Hmm.
that it's already there.
Yep.
Um, it's interesting to watch people. Some people just really dive into the trust, and some people go, I think,
Hmm.
I'm not sure, but,
Yeah, totally.
and which is totally
Yeah,
fine
either way, I can work
and
for you.
normal and natural.
Hmm.
Yeah.
Hmm.
But like after a few sessions, I'm sure like I see is that you see this trust
Hmm.
within themselves, that
Yes.
now it goes from like I think to just kind of like answering,
Yes.
yeah, the question,
Yes. Yes, totally.
which
Yeah.
all comes from the inner wisdom. Is that what you guys call it?
Um, I mean, I think everybody needs to kind of find their own name
Yeah.
for it for themselves.
Yeah.
So yes, to inner wisdom, inner voice, inner wisdom. It's kind of trying to sift through what's everybody else's voice versus your voice.
Right.
Um, yeah, I think it's an important place to hold the space for the person of their own. I guess I would say inner knowing, um, which can lead to inner wisdom. It's kind of all the same.
Yeah. Yeah.
Hmm.
So when it comes to, I mean, it's almost an obvious question if you think about it, but I'm guessing it was just kind of a side effect of doing pelvic floor work that it became the sexual trauma work, right?
Hmm.
Because it's
Hmm.
all tied into that area,
Yeah. Yeah.
right?
Yeah. Yeah. And, there is the aspect of doing like bladder and bowel work, which I really like bowel work as well, for whatever reason I do. um, but it's when I started kind of seeing, especially with the functional neurology side, when I started kind of seeing the connection between what's happening at the organ level, what's happening at the functional like the neurological aspect, and then what's happening at the emotional aspect and how those tie together, that deepened my body work, that deepened my presence, with holding space for the trauma itself or whatever difficult experience was coming through. And it's a very vulnerable area, right? And I can't tell you how many people have said, I've never told anybody this, or I think this is TMI, and I always have to say there's no such thing as TMI in my office, right?
Mhm.
And even I've had a lot of people tell me things that they won't tell their therapist either,
Right.
because I'm in such a vulnerable space for them. Right. And I honor it. I definitely take it slowly. I realize that it's a space that is meant to be sacred. and to be honored in that way.
Yep.
Yeah, and I hold it like that. And I hold it as like, as a facilitator, that um, that it's an honor to be able to hold that space for people in such a vulnerable space.
Yeah, I totally agree. So we have listeners who are the patient.
Mm-hmm.
We have listeners who are a friend or a sister or a mother or father, of someone who might benefit. And we also have people who are listening that are practitioners, nurses, doctors, clinicians of any type. Let's walk through kind of both sides of the coin, as in um, what that looks like for them in terms of utilizing someone such as yourself for these kind of services.
Mm-hmm. Yeah, so let's start on the clinician side. So if there is somebody that's a referral, I really love co-treating. I believe in collaborative process and creating a team. And so it's knowing that my job as a pelvic floor PT and somatic therapist is to help, like I'm not going to give a lot of the diagnoses that a physician could give, right? But I'm there to help their patient know what is possible for themselves and in their body, and to take it beyond medication,
Mm-hmm.
right? And to help develop skills for that person. And this kind of speaks to the patient or the client in my office, and the physician or the nurse or whoever it is, that knowing that ultimately it's teaching the person that they can trust their own body, that they can know what is going on and internally. And then ultimately I feel like it's a need that hasn't been met yet. And so trying to figure out that need. And so as far as working with healthcare providers, other healthcare providers,
Mm-hmm.
it's knowing kind of when to refer to a pelvic floor PT, right? And honestly, I feel like anybody post birth really should see
Yeah.
a pelvic floor PT. So that's an easy one. But understanding that pelvic pain is not normal. It might be common, but it's not normal. And pain with sex is absolutely not normal. Again, common, not normal. Um, and so if you have anybody in that realm, that's a referral so that we can work together, because I'm not going to be the one that's navigating the medication. That's not my role.
Right.
And I'm not going to be the one that's navigating a lot of the diagnoses. And sometimes there are actual surgeries or procedures that need to happen, and that's not my role.
Right.
Right. And so if it has to do with, musculoskeletal aspect, or really helping people deepen into the kind of emotional piece, that can be my role. But I also like having a therapist at times on board, because a therapist, like, my role is not to go through the stories with people for the most part. Like, I'll work through the body, but therapists have their own roles. And I recognize that I'm not a licensed mental health care provider, and I don't want to be, right? But I work with a lot of them.
Yeah. Yeah. And in healthcare, we're used to working in teams.
Mm-hmm.
We're used to working collaboratively with the physician, the nurse, the social worker, the physical therapist, the dietitian. Like, there's a reason why we use a team approach,
Mm-hmm.
because it's mind, body, emotion, spirit,
Yeah.
and it's all needed. So that's great information.
Yeah.
Okay, so anything else with that on practitioners?
It's yeah, as far as I'm just trying to think, because that covers like deeper into clinicians. I'm just trying to think if there's anything else as far as patient. I guess for me, it's for patient and client. It's if you are listening and you feel like, oh, I've been experiencing X, Y, and Z for a long time, and that's considered normal, like, just to know it's not. And there's so many more things that can be addressed and looked at.
Right.
And so to start asking your providers, and the other beautiful thing is that in Utah, at least, we are a direct access state. So you actually don't need a referral to come and see me. You can just come and see me.
Nice.
And if there is something that I see as a red flag, I will then refer you to to a medical care provider,
Mm-hmm.
or functional health or whatever that is,
Mm-hmm.
to start creating that more integrative approach.
Okay. Well, as you were saying that, though, something came up. One of the things that my intention for having these conversations and having this podcast is to have the discussion about how do we build trust, regain trust, build trust within the system, uh, as people are losing trust
Mhm.
or, questioning a lot of the education and where we're coming from. So my hope is to listen and to hold space for this trust building exercise. So, do you have any thoughts on how we can build trust
Yeah.
in the system?
I think the first thing is integrity.
Mm,
If we do not, as providers, hold our own integrity,
hmm.
then we're acting as part of the system.
Yeah,
And what that integrity looks like, I mean, that you have to know your own integrity, what your beliefs are, and be able to, like, what are the hills you're going to die on,
yeah,
and to stand on that, and to make sure that how you're living your life, how you're holding yourself and your own energy is aligned. There is Kylia Taylor did a book around this specific topic
okay,
for people that are care providers, right? And to me, understanding that, what there's two things she talks about where that gets you pulled off of your center, which is either a desire or a fear. And once I started understanding that and really understanding my deep desires and my deep fears, and being able to notice when those come into play, and then stepping back and taking accountability, and like, I truly believe that to be able to hold your own true alignment and integrity, you have to be able to be completely accountable,
yeah.
regardless of what's going to happen from that accountability.
Well, and I think you bring up a good point in terms of operating from fear. I think a lot of clinicians, because they haven't been given the skill or it hasn't been brought to their awareness, myself included at one point, um, when we are interacting with patients and clients, a lot of times, if we aren't aware of the fear, we are projecting that onto them. And so
Mhm.
you got to do this because if you don't, this will happen.
Yep.
And so we're kind of forcing a decision or a path that maybe the client isn't on board with, the patient is on board with, wants some time to think about it. But the fear is like, well, if you don't do this, something catastrophic is going to
Yeah.
happen.
Yeah.
Where if we can shift that and say, I've done the education, we've interacted, I've held space, but ultimately it's up to them.
Mhm.
And I can document that I've done my part, then the fear should subside. Do you agree? Or what are your thoughts
Yeah,
on that?
for the most part. I mean, I think that there's a difference also between, if we talk about fear, there's a difference between anxiety
Hmm.
and actual true fear,
Yeah, yeah.
right? And that has to be differentiated, right? Because if there is truly a true fear, like my life's in, right, but that goes into more physical thing, and hopefully that's not going to be happening in your office, right, or wherever you meet them. But the anxiety, the essence of the depth of anxiety, is the fear either that what you want isn't going to happen and you're not going to get it, right?
Yeah,
Or the fear of what you want, the opposite, is going to happen. And
yeah.
so recognizing, holding that, and recognizing that fear is a frequency,
Hmm.
and it's a nervous system state, right? So when we say frequency, it truly is coming from what is the nervous system experiencing, what is it projecting out into the world.
Right.
And so as we build trust, it's recognizing where we are as providers in our own nervous systems and how that might be projecting out to that person, right? Because if I, like, you were talking about how if we project fears onto them, or saying that, hey, here's these options, I think you should do this, it almost feels like high pressured sales,
Yes.
right?
Yeah.
Rather than, let me educate you, let me tell you from my experience where this is at, this, and then being
Go home
able to
and sleep
give,
on it.
yeah, yeah, being able to give choices, right? What's interesting though is that I find, and from that place of being able to give choice, is definitely a place of trust.
Yeah.
But what I've found, especially for my clients that have a hard time being sovereign within themselves is that when a clinician gives them choices and gives them, here's like 3 options, and here's, what I can tell you about each of them,
Mm-hmm.
that they actually really struggle with that because
Mm-hmm.
they want the authority figure to say, this is what we're going to do. This is why. And I totally understand
Yeah.
that completely. Right.
Yeah.
And especially because they don't have the training, they don't have all of that education. And that's why they're coming to them. Right. And at the same time, I always look at that and say, what is it like for you to make a choice? What is it like for you? Like, what's your relationship with failure?
Right.
Right.
Oh, I love
And
that.
yeah.
Yeah.
So it's always a curiosity for me because I am someone who wants people to have choice and want people to do what feels the best for them. And that's why I always say, like, if I'm not your provider, I'm not your provider. That's totally fine. I'm happy to refer you to other people.
Right.
I don't want to be in that high pressured sales, but I also know that there's an alignment. So I always have to ask also, is there a fear coming up because you know that there's going to be movement and
Mm-hmm.
that's scary because there's going to be change, or is it truly like there's not an alignment here? And if
Right.
that's the case, cool.
Yeah. 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 Because when we are, I personally don't have a problem, and maybe some people do, but I personally don't have a problem if someone says, if this was your loved one, what would you do?
Mm-hmm.
Like, because I feel like that kind of, takes a step back. I'm stepping out of
Mm-hmm.
the role a little bit and
Yep.
into the empathetic
Yep.
caregiver role with my knowledge. I've seen it all in the,
Mm-hmm.
like specifically in like hospice care. I've seen it all.
Yeah.
And based on my experience, this is
Mm-hmm.
what I would do.
Mm-hmm.
But so that also takes the pressure off when people, and I think that's a good question to ask. Like, if this was your loved one, and some
Yep.
people don't like that question. I've heard other clinicians don't love that question. I don't mind it at all. I think it's a great question.
Mm-hmm. Yeah.
Um, as long as you're still making the decision on your own. So, something we can do as patients, all of us, is learn to be good with making decisions.
Mm-hmm.
And so, like, that's why the somato work is so important, because that's learning to trust yourself, learning to trust your inner wisdom, learning that you don't need an outside source to get those, get that wisdom from, that
Yeah.
information from. So
Yeah.
awesome. Okay. So there's something here. Let's see, on your website, I want to kind of talk a little bit about,
Mm-hmm.
and then I have like maybe a few more questions for you. Um, so, and I totally resonate with this. So this is on your website. Your website's beautiful, by the way.
Thank you.
Root and restore somatics dot
Mm-hmm.
com for anyone who's listening and wants to follow and learn more. It says, at Root and Restore, we believe your mind, body, and spirit are intimately connected. You are not broken or in need of fixing. Your body holds emotions and trauma. Your body communicates with you and seeks your attention. Your body is your friend, not your enemy. You hold your own power and authority within yourself. You possess deep inner wisdom and knowledge within you. You have the ability to heal yourself. You deserve to experience joy and pleasure. All of you is welcome. Man, we could go line by line and just talk for a good couple hours.
Mm-hmm.
Um, but let's talk about you're not broken or in
Mm-hmm.
need of fixing.
Yep.
Say
That's
more
a
on
big one. It's such a big one. And that's why I chose to name the new program and the new business Wholesome Already. Um, because there is this element in whether it's society or just healthcare, it's almost like we need people to be broken, right? That's
that.
how the system keeps going.
Right.
And I understand the reality of the feelings that are so intense of brokenness, right? If something's not working properly, right, then it's considered, in English, we consider it broken.
Hmm.
And the way that I look at it is, especially from a nervous system perspective, is what is the need that hasn't been met? It's because, and most of the time, the system, there is nothing that's broken. The system is doing exactly what it's meant to do. It's
Yeah.
just that it's stuck trying to meet a need in a way that is no longer helpful. It may have been at some point as a survival strategy, but it's no longer helpful. And it's actually more of a self sabotage, but it looks like a pattern of brokenness.
Wow. Yeah.
And
I love
so, yeah, so for me, it's understanding that whoever's in front of me, that they've been whole this whole time, right? That the wholeness is that the brokenness is within the wholeness. And I think of it as like, if you look at the mirror, if you look at a mirror that's in a circle, right, and you break the mirror, all of those broken pieces are still within the whole, still creates the whole.
Sure.
There's a Hindu goddess that is the goddess of never not broken. And I really like that because the essence is you can't be broken because you already are. And the brokenness is the whole point. But at the same time, you're never broken. You're actually never broken because you've been whole the whole time. And it's
Mm,
just looking at the needs that need to be met. And
yeah.
what happens if you treat yourself as whole and see yourself as whole rather than broken.
Yeah. I heard it first from Jane Fonda, so I'm going to give her credit, but she said, we're not made to be perfect. We're made to be whole.
Mm-hmm.
And that was really came at a time that I really needed to hear that. So
Yeah.
I appreciate your insights on that.
Yeah.
Okay, so let's talk about your body holds emotion and trauma.
Mm-hmm.
Tell us more about that. I mean, I know what I know from my work, but you uh, explain from your side of the
Yeah,
coin.
so I mean, it's been interesting that you bring this up now because there's this whole like debate happening
Right?
specifically around this. Right.
I was just going to say that.
Yeah, so
Like,
it's so interesting because there's the camp that's like, no, it's actually in the tissue and it's in
mhm,
the feeling or like in the actual structure. And then there's
right,
the no, this is all nervous system based. It's the
right.
brain completely creating all of this. And to me, I'm kind of in a both and
Yeah,
where from the understanding that I have around the nervous system and neurology is that there are patterns, right? That the brain is creating interpretations, and we're working with afferent efferent nerves. And so there is a pattern that is actually happening that is from the actual nervous system, right? And then that is directing what else is happening in the tissues and in the structures. And I can also tell you from having my hands on people's bodies over and over and over again that,
yeah,
yeah, there are specific places and specific areas or structures or patterns where the body is literally constricted,
right,
right? And it or is held in certain ways that is not allowing flow.
right.
And so for me, the body does hold it. There is an intelligence there that is,
Absolutely.
how you see that, you could still see that through the eyes of the nervous system. You could still see it through the eyes of the actual structure. To me, it's a both and.
Okay. Yes, I agree. Hang on one sec. I feel like I'm getting super sun. Um, so it's so funny because I saw that reel on social media
Mhm.
that contradicts that the bodies or that we hold trauma in our body.
Yeah.
And um I was just like, we don't that doesn't help build trust.
Mhm.
Like your answer to me is a trust building answer. And I would really wish that as practitioners, our responsibility is how can we build trust? Um, because an answer like that at this point in the game, especially with the whole body keeps the score,
Mhm.
um, era,
Mhm.
it just adds to confusion.
Mhm.
It adds to trust, and then we go, okay, now like I just feel like every day we're like, okay, what I thought was real is no longer real. Oh, what I thought was real. It's just like it's too much. So,
Yep.
I'm with you. My hands-on experience alone has convinced me,
Mhm.
besides that there's actual evidence,
Mhm.
um, that it's real, that the body does hold trauma. Specifically, the fascia is called the shock absorber
Mhm.
for a reason, for
Yeah.
physical and emotional trauma.
Yeah.
So obviously,
Yeah.
it is a brain and network issue when we are stuck in trauma too, and that's why we need to do the mental work around that with the
Mm-hmm.
nervous system.
Yeah. Yeah. And I truly believe that if we look at the cellular level, right, so much of this comes down to, and this is kind of where I hold into the idea of boundaries, um, that there are kind of like gates, right? Cells open and close. They open and close to let things in and exchange happen. And I think that if we as humans do not know how to open and close correctly, right? If we're saying
Mhm,
yes when we really mean no, or
mhm.
vice versa, the cells are going to do the same thing. And that confusion occurs in the body. So it's interesting that you're talking about trust, because to me, so much of it, again, comes back to rebuilding trust internally. And this, to me, I believe that the cells do follow that energy.
Yeah, awesome. Love that. Okay, so I want to go back to these. I mean, seriously, I love all of these. You were so intentional. It's very clear that all of this was super intentional,
Mm-hmm.
how you articulated this. So let's see. Let's talk about you have the ability to heal yourself.
Mm-hmm.
Tell us more about that.
Yeah. So again, this comes back to, if you're not broken and you're whole already, right, then maybe the healing is more about meeting your needs. And you have the ability to listen to what your body is asking for,
Mm-hmm.
whether that is, I need a hug, or I need food, or I need water, or I need to go to the bathroom, or I need to rest, right? It's all listening to each one of those is, or that even can go into like, I need to leave a relationship, right? So all of that can kind of play into it. That when we say, or when I say that you can heal yourself, every choice you make is either moving toward health or away from health.
Yeah.
And again, this comes down to a nervous system thing. Which form of nervous system are we in? Are we in a fear-based nervous system, or are we in a trust-based nervous system? I truly believe that the body knows how to heal itself. It may need help, right? That doesn't mean you have a broken bone and you just are like, oh, it's fine, it's just going to heal itself, right? Like
Right.
sometimes you still need surgeries, sometimes you still need interventions, but that's because there is a need that has to be met there,
Yeah.
right? And so it's listening to those deeper needs and then creating, and this is where the precision comes in, that I can throw darts at a dartboard and hope something sticks. But if I really know what I need, if I know what that thing is, then I can create one dart that hits a bullseye, that is more precise, that is very impactful, that the body knows what it needs and it's asking for, whether that's a specific nutrient, right? Or whether that is a specific support system or a different environment. The body knows how to thrive in that.
Mm-hmm. Yes. Well said. Well said. Um, okay, this one well, I have a little something to share with it too, but your body is your friend, not your enemy.
Mm-hmm.
And I want to hear your experiences, but real quick, I this resonates because when I worked for a place called Survivor Wellness, it was for people going through cancer treatment, chemo. They were either diagnosed or in recovery or going through the journey, any stage. But that, I was doing craniosacral therapy as a volunteer, and that was a continuing theme that I noticed that they were at war with their body.
Mm-hmm. Mm-hmm.
And there's a time to be at war with your body if you're fighting something like cancer, I guess. Um, but at the same time, I felt like, oh no, we need to make friends. Like we need to say you're doing a good job, and like how do I help bring them back into harmony with each other? What are your thoughts on that?
Yeah. Well, and it's interesting that you said that there are times where we do need to be at war. And I would say maybe
Yeah,
to
yeah.
that, but
Hopefully
is it
that
still really even war, right? Or is it just there's interventions that
yeah,
need to occur that maybe might feel harsh,
yes,
right?
yeah.
There was a podcast that I listened to about a woman going through cancer, and I can't even remember what it is. I wish I had the actual one. But she talked about in her process that she would, with the chemo, that she would like in her process, she would pray over the chemo every single day. where she would like imagine it turning that chemical into something that her body was more like water or something in that structure that would actually be helpful for her, right? And her progression blew doctors away, right? And it's like she's still taking this poison that we know chemo's poison into the body,
Right, right,
right?
right.
But when we are able to shift the way we see things, Wayne Dyer said, I love this quote. I'm a quote person.
Yeah, yeah,
And he said, if you change the way you see things, the things you see will change.
yeah,
And to me, I significantly hold to that, and I've seen it over and over again. So if I see my body as an enemy, then if somebody comes and knocks on my door, right, and I'm even if it's my neighbor that's bringing me bread, but I consider them, I see them, and I'm expecting them to be an enemy,
right.
then I'm going to be like, why are you bringing me bread? Did you lace it? Did you, right? Like, or what do you want from this?
Yeah,
Right? Whereas if I see it as not hostile but friendly, then it's more open and curious and accepting. And
yeah,
then what can we do when we're friends? Now that doesn't mean we don't have feelings of betrayal,
right.
right? And those are very, very real. And so I want to hold for people that go through chronic pain, that go through these difficult experiences, that betrayal is a very, very common and normal feeling.
Sure.
It's not wrong.
Right.
And it's still a feeling.
Yeah.
And to be able to separate feelings, right, from who we actually are or who the body actually is an important step to be able to move towards connection. Because the other thing is that if you're living in a vessel where you feel betrayed all the time, that's going to be a really difficult place to be. And you're basically at war with yourself all the time. And that's not a peaceful place to live.
Right. Yeah. And that's why, if you are feeling that way, that's why a practitioner like yourself is really uh, crucial, is to help you navigate how do we rebuild
Yeah.
this relationship, right?
Yeah. Yep. Yeah. And it's just about shifting perspective over time. And it does
Mhm.
take time. It doesn't mean like it's like, oh, let me just change my thought of like, oh yeah, my body's my friend. Now
Yeah.
I'm fine. Right. Like that is not, there's so much
No,
more
no, no.
to it.
It's about honoring the feeling.
Yeah.
It's about
Yeah.
giving it a safe space to hear, like
Yeah.
hear what it has to say, and why, why is it holding on, or,
Hmm.
it's a relationship with
Yeah.
yourself. Yeah.
Yes. Yeah. I always ask people if your body was a person, tell me about
Mm.
the relationship between you and this
Yeah.
person and what type of
Mm.
relationship do you actually want? What do you desire? Because ultimately it comes down to what you want. And some people have never been asked what they actually want for themselves.
Right. Or they haven't seen it as a relationship.
Hmm.
Both. Yeah.
Hmm.
Okay, so let's talk about, we'll end with this, and then I have a question. I just kind of want to, just a parting question, but you deserve to experience joy and pleasure.
Yes.
Tell us.
So, for me, in my process, given I came from a family and a space of purity culture where it was work, 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 right? And there wasn't a lot of play. And play is so important for development of the brain and the body. And I truly believe that we are meant, I mean, our bodies are meant to experience pleasure. If
Yeah.
we, and not just sexual pleasure, I think that's a big part of it, right? But just pleasure and joy in general.
Mm.
And that is the essence of we are beings that have desire. I mean, why do we have dopamine? Dopamine is desire, right? And so, to me, I think breaking down the barriers to joy and pleasure can be an important part of the healing because and shifting into a different identity or a different space of wholeness because I truly believe that pain and pleasure coexist,
Yeah.
right? And so when we talk about wholeness, it's accepting all of it. And often the joy and the pleasure, I think, are almost more difficult to accept and to experience than the pain. Like we're so used to pain, it's like the suffer culture. And for me, I know that, I have like pioneer heritage where it was like suffering is the badge of honor. and I just don't want to do that anymore. I'm over it. I'm done with that. And so to sit there and dive more into the traumas and everything, it's like, yes, all of that is important and real and steps. And also, can we create a new story? How about we move into a nervous system where we work with creation and that we are actually creators, which
Yeah.
is full of joy and pleasure. And that is, to me, that is eroticism, right? It is the, like, truly, in eroticism is our power. It's our inner creative power. It's our life force energy that is, it is our divine birthright.
Yeah. Well, I remember I got to a point in my life where I said, why does pain always have to be the teacher?
Mm-hmm.
And, when you start asking the same question long enough, you get an answer. And I remember hearing in an interview or a podcast where someone said, pain's the teacher until you decide it's not. And you let joy and love and serenity, peace, like all those other emotions to teach you just as much as pain.
Yep.
And that was like a big shift in my mindset when I was like, oh, like
Yeah, I love
I
that.
can kick pain to the
Yeah.
curb.
Yes, I
Like
love
it
that.
still
Mhm.
has a place, but it's not the primary teacher
Mhm.
anymore.
Yeah.
So,
Yeah.
okay, so I have this concept I'm working with. I don't know if it's a concept, but it's something I believe. That we are mind, body, emotion, spirit, which is not my concept, it's the concept of the work we do. But I believe that we're always have one, that if not more than one, that needs some work, or that it's front and center in our life and it's the one calling for our attention. Of those, do you have one that's front and center calling for attention right now?
Right now,
Yeah.
as soon as you said that, I would say the one that just called was spirit.
Mm. And what does that mean?
Um, I hold the term spirit and spirituality very lightly, and
Mhm.
I often reuse the word connection.
Mm.
And so to me, it's about is whatever choice I'm making or whatever I'm doing, is it connecting or disconnecting me from myself, from the people around me, from higher source?
Yeah.
And so my practice right now, I'm actually in a deep trust practice right now with myself and my
Mhm.
path. And like in that aspect of like always having to do go, right? That I'm really learning to just step back and just listen and rest and only move when I'm directed to or when I have the desire to. So
Yeah.
that to me is that deep spirit practice.
Oh, I love that. Thank you for sharing that.
Yeah.
Well, I mean, you have been amazing to talk to. I feel like you are a wealth of knowledge. It's obvious that you've been down your own journey and path and have done some pretty deep digging. I think that's kind of the pattern of anyone that I'm talking with right now. Like we've been through our own journey. Now we want to take that and help others. So
Yeah.
thanks for the work you do. Bonniejane Monson, and you can find her website at rootandrestoresomatics.com. And we'll link her information in the podcast as well. Also, for the Holistic Nurse Academy podcast, please feel free to like and subscribe, share with your friends, family, practitioners, anyone who you think would be interested in this conversation, where we're bridging the gap between Eastern and Western medicine and having different conversations along the way. Thanks again, Bonniejane. It's good
Yeah.
to see you.
Thank you so much for having me.
Have a great day.